depends, so it's going to take a really long time.
And despite the government's positive outlook,
to date, 16.4 million uninsured people have gained health care coverage.
It's had to jump through a lot of hoops.
The setbacks, I remember clearly.
U.S. judge in the state of Florida, Pensacola, ruled that the new health care law is unconstitutional.
Why is the Obamacare launch such a mess?
House Republicans have filed a lawsuit, not over immigration, but over Obamacare.
The Supreme Court will take up another challenge to his signature Obamacare law.
And the hoops keep on coming. The sentiment across the GOP presidential platform is the same. When can they repeal or replace the Affordable Care Act?
I would repeal it, and I'd replace it with something far better.
Well, there's no question that it needs to be replaced before you repeal it.
Those critics argue Obamacare isn't doing enough to make health care more affordable.
I don't believe we should have employer mandates, employee mandates, or health care mandates that make health care insurance so extraordinarily expensive.
We want affordable and accessible health insurance for everyone in America.
On the other end of the political spectrum, Hillary Clinton vows to keep Obama's signature Health Care Act afloat.
We've got to defend the Affordable Care Act.
And Bernie Sanders plans to give it an upgrade.
Let's pass the cost-effective way to provide universal health care to all of our people.
Affordable health care might be the biggest sticking point among candidates, but it's hardly the only one. Jeb Bush brought the debate to reform entitlement systems, and specifically Medicare, back into the campaign. The push for Medicare reform is hardly a surprise, given a report from 2012 that says the program will go broke by 2024.
But that we need to figure out a way to phase out this program for others and move to a new system.
And other GOP candidates say something must be done too.
We need to save Medicare, not simply delay its bankruptcy.
Medicare, we have to take care of you.
And on the eve of Medicare turning 50, Democrats rejected the notion to reform.
Today we're often told that Medicare and Medicaid are in crisis. But that's usually a political excuse to cut their funding, privatize them, or phase them out entirely.
We need to move to a Medicare for all single-payer system.
When it comes to healthcare, there really isn't a more polarizing topic than abortion. And this time around, the friction centers around defunding Planned Parenthood. The discussion picked up when anti-abortion group the Center for Medical Progress published video showing Planned Parenthood executives discussing the illegal sale of fetal body parts. And since then, defunding Planned Parenthood has been the main focus for the anti-abortion movement and GOP presidential candidates.
And the time has come to end all taxpayer funding for Planned Parenthood.
This has nothing to do with whether you're pro-choice or pro-life. This has to do with the moral foundation of our nation.
We need to defund Planned Parenthood.
And as lawmaker threats to defund Planned Parenthood rise, Democratic candidates are defending the group's importance for women's health.
If this feels like a full-on assault on women's health, that's because it is.
It is improper for the United States government or state government to tell every woman in this country the very painful and difficult choice that she has to make on that issue.
What's clear is, on the topic of healthcare, the debate is centered squarely around funding. Candidates are arguing over what does and doesn't get government money. For Newsy, I'm Micah Sargent.